So tell me more about the research that you do.
Sure. So we have a lot of active research projects in vascular EDS. And so my training as a researcher, so I'm what's called a clinical outcomes researcher. So that means you take a disease and you try to figure out what are the risk factors for negative outcomes, like for death or dissection. So that's different than a lot of people in this space. So a lot of people who study genetics want to know what causes genetic problems, right? So like Dr. Byers is, one of the forefounders of figuring out why we have vascular EDS, what's wrong with the collagen. And so that's most people in genetics are sort of what we call etiology researchers, right? People who discover genes, people who discover gene modifiers. And so I'm really different. I'm a trained epidemiologist. So I study rare diseases and how do we predict the outcomes, and then how do we use the knowledge we have to prevent outcomes or improve outcomes. So I sort of take that look on VEDS, and that's really different than a lot of people. So our research is, we want to enroll as many families as possible. And obviously, as a pediatric cardiologist, I have a focus on children and young adults. And we sort of say, one of our big research projects is looking at all the imaging and saying, is there anything from the MRIs and the CTs and the echoes that helps us figure out who has more fragile vessels, who doesn't, who do we have to restrict, who don't we have to restrict, who do we have to worry about? So one of our projects is using vascular imaging to predict outcomes. We do a lot of perinatal, so around birth, pregnancy, and newborn research. Is there anything we can tell from the newborn period to help detect VEDS, or if we know they have VEDS, that we think might have better outcomes? We also look at things like bone density. And then we also look at risk stratification. How can we if a 5-year-old walks in, how can I say, you're not at risk for 10 or 12 years of an event, or like, oh, we probably have to watch you a little closer, watch you a little tighter. So it all has to do with sort of predicting outcomes to kind of be more informed and know who's a better candidate for certain therapies as they come.
Yeah, that's really interesting. So this idea that, something that really popped out at me when you were talking is this idea that not everybody has the same exact risk. Like there's variations within our community to keep in mind. That's a really great concept, because I think a lot of people really I just think of myself and like exercise, and how much I used to love exercise. And then when I was diagnosed, I found all this scary stuff online about what I shouldn't do, and like very strict restrictions. And then I meet other people that were like, oh no, my doctor told me this, or my doctor told me this. And there's so much variation there.
Well, there is. And we know, exercise is a great example of it's huge for mental health, right? Especially in children and young adults. It's a huge part of people's daily lives. It makes you feel better. And like, I see kids that are diagnosed, I have a whole family and they're all motocross and they all have VEDS, and they don't have a null mutation. And I don't know how they did that for so many years, and they still do. And then you have other families, that have an event really early in their life, or someone in their family. And how do we really, rather than, it's not just mutation, right? There's other things. And can we better understand so we can help reassure families? It causes so much anxiety and stress when you get a diagnosis, but I don't think we shouldn't diagnose people, but can we better risk stratify?
Yeah, I love that. So if people want to get involved in your research, do they have to live near Houston, or how do people get involved?
Absolutely not. And, actually the pandemic helped with that. Our hospital used to have restrictions where to do this kind of research, we had to examine you in person or get a special release that we can examine your records, but you still had to be a patient of our hospital. But it's totally changed. So we can do everything virtually now, which is great. We don't have we'd love to examine people if we can, but we don't have to. So our biggest project now, so we just started a huge project called Clarity, and it's VEDS and Marfan and Lowe's Dietz, but it's at internet. It's 30 programs in the United States, and plus the Canadian group is now going to join us. Cool. Plus a group in Russia and a group in Pakistan.
Wow.
And yeah. And we're collecting patients. We're hoping to get as many possible. And what we're asking for is medical records, right? Medical records, and then probably interviews to really get the information we need. And then we'll know what outcomes they have. And we'll look at the past history of things that have happened. And then we'll follow everyone going forward. And we hope this is in perpetuity if we can keep getting it funded, but we're funded for the next few years. Perpetuity, so we can follow people along. And so this is one of the ways, which is neat, because all the major hospitals and pediatric hospitals in the country are contributing. So we're really excited.
That's wonderful. So how does somebody sign up for that?
So they can just email me, or I don't have my research coordinator's number handy. We're going to call it Clarity. We're going to get an email handle for Clarity, and our Clarity website, which is Clarity Registry, is going to go up soon, but it's not live yet. So for now, shainem@bcm.edu can email me. You could email the Marfan Foundation to email me, but we can get people registered. And the way that it'll work is that you can either register with us directly. If you register with us directly, we can interview you, we can call you back, we can request your medical records. You can also register through your hospital. The hospitals have the choice though. They can either get all your information, but that's pretty hard work. Like it's pretty laborious for each hospital to do a lot of consents, and not everyone has the funding and research staff to do that. So we give them the option to just, for us to extract records, but they have to get permission. So it's a little more, depending how your hospital has elected to do it. People do it in different ways. They may not get as many detailed records depending on their staffing, or you can enroll directly with us. But either way. Yeah.
So I'll put that information like in the podcast description too. So
that'd be perfect.